What is up, y'all? Welcome back to another episode of The Black Experience. Welcome back to Season 5, Episode 6. Today, y'all, we will be talking about mental health in the Black community and the importance of it. Before we get started, I want to give a huge shout out to all my supporters, everyone that supported me on this journey. Thank you so much for all your support. Thank you so much for all that you've done, for your donations, for your support, subscription. For all of you that are new, welcome to the podcast. Welcome to this journey. This train ain't stopping anytime soon, so hop on and enjoy the ride. Today, y'all, this is a topic that I have been wanting to talk about for quite a while. And it revolves around the topic of mental health. Now, in my college, mental health was a big topic. In fact, it was a topic that was discussed about many times by many students. But me, being of an Eritrean background and coming from an Eritrean household, mental health was not a topic that we talked about. Neither was depression, neither was any kind of emotional, mental health topic among our household. And it just wasn't, just because that wasn't the culture that we grew up with. Now, when it comes to the Black community, there is a deep stigma around mental health specifically. In fact, I was so curious about this topic that I found an article on McLeanHospital.org, and I'll link the article in the description below, where it talks about Black mental health and what you need to know, and how it's a taboo topic in Black communities. So I wanted to share some of the history of where that stigma comes from, where that trauma comes from, and then ultimately what we can do about it in the end of the podcast. Right. So the article, right, talks about Christine M. Crawford, an MD, who works as a psychiatric rotation in her medical school. Now, Crawford, being Black, obviously was disregarded by many people that were close to her. And a lot of people asking why she would become that kind of doctor and not a quote-unquote real doctor. And she had known that because of those responses, that was how she learned that mental health was a huge taboo topic in the Black community, and how it was a huge stigma. In fact, going back into the stigma and into the history of it, for those of you who don't know, and I didn't know this before reading this article, but MLK himself, Martin Luther King Jr., had severe depression during his life, right? And honestly, a lot of us could have probably guessed that, considering everything he had to deal with and all the stresses of a movement that he was starting, a movement that would change history for good in this country, right? He had severe depression during many periods of his life, but he refused psychiatric treatment, even when he was urged to do so. And that is a common trend that is not only among many Black people in the community, but also even including myself as well, right? We hear about treatments, we hear about therapists and counselors, but there's a stigma. There seems to be a stigma, and obviously it's not everyone, but there seems to be a stigma. Now, when we think about it, when you think about racism, trauma, mental health, Black Americans, the Black community has shown a lot of resilience in the face of adversity for many centuries. Now, this goes all the way back to the 1600s, obviously, when Blacks we were faced with oppression in the form of enslavement, right, of both Africans and their descendants, right? Slavery, the 60s, Civil War, all this, a lot of trauma, a lot of racial trauma built up, caused a lot of stigma to come around mental health. In fact, according to this article, researchers believe that racial trauma was one of the reasons Black people in some communities have higher rates of PTSD, Post-traumatic stress disorder compared to white people, 8.7% compared to 7.4%. Nearly 65% of African American youth report traumatic experiences compared to 30% of their peers from other ethnic groups. Not only this, but since those 400 years of the slave ships coming, there's something called intergenerational trauma. Now, you may have heard of this, but I did not know that there was an actual process for this called intergenerational transmission, which essentially means that trauma can be passed down from one generation to another. Stress can cause changes to reproductive cells, to the uterine environment where a fetus develops as well, right? And so because of that and knowing this fact, people who had ancestors that experienced severe trauma may be more prone to mental health conditions, right? This is a real thing, and this is something that I didn't even consider myself. I've heard of intergenerational trauma before, but did I think it was as serious as it actually was? No. Now, as we're uncovering the history behind this, we kind of have to ask ourselves too, okay, what does this mean for the Black experience? And what does this mean for mental health today? For some of you, you may have heard the term microaggressions, right? Have you heard of microaggressions? Microaggressions are a form of racial trauma that people use today, right? And they've been around for years, for centuries. But that word, I first heard of it in college. But it's a form of racial trauma, and some examples could be, a white professor that might not call on a Black student, or you walk into a store and you're being followed around, right? And you're thinking, okay, is this person following me around because I'm Black, because they think I'm going to steal? Combination of the two, because I'm Black and they think I'm going to steal? What is it? These kind of things have still transpired. Then they continue to transpire. And we're still, again, uncovering that history of where that stigma, that taboo comes in, right? Systematic racism, right? Obviously, we all know that racism has led to higher poverty rates, increased incarceration of Black people, especially Black men, less access to healthcare and housing, right? When we think about them, Black people not seeking the help that they need, why is that? Right? Yes, we have a history that is brutally bad, that was bad on our ancestors, and can still be felt today, 400 years later. But why are Black Americans less likely to seek mental health care? Right? Why is that? Well, number one, Black people are far less likely to seek that care. In fact, 25% of African Americans seek mental health treatment compared to only 40% of white Americans. Unequal access to healthcare is another major contribution to this, right? It's one thing to say, okay, intergenerational transmission of trauma has transpired. But what about people today? Why aren't Black people today taking action? Well, one big reason for that could be unequal access to healthcare. In fact, the article states that unequal access to healthcare is one major contribution to this disparity. Nearly 10% of Black people in the U.S. do not have health insurance, compared to 5.2% of non-Hispanic white people. Right? Access is likely. Access is a huge part of it. If you don't have access to healthcare, if you don't have access to certain resources that you need to get the treatment that you need, then you won't be able to access it and you won't be able to get to it. That's one thing. Another barrier to treatment, another reason, and this is something that maybe some of you have heard, but not everyone. But research studies are less likely to include members of the Black population, is an example. And this stems from what? African Americans having an a mistrust in the medical and mental health systems. Why? Why, you may ask? Well, there's a lot of historical cases. One such example is the Tuskegee syphilis experiment that happened between the years of 1932 to 1972. In those 40 years, Black people were subjected to medical experiments without their permission. And these are all things that you can Google and look into. Another obstacle, mainstream psychotherapy has its roots in Western Europe, right? And other founders of psychoanalysis and other early treatments were mainly white men. Again, this is all a mental thing, right? When you see people that don't look like you doing something, that can be less motivating, obviously, than when you see someone that came from your background, from your town, from your place of origin, and say, hey, he was able to succeed. He was able to embark on a journey despite the obstacles he faced from this neighborhood that we grew up in, or from this or whatever. Therefore, I'm now inspired to go above and beyond. And that's my goal with this podcast too. Is to say, hey, listen, for many of you that will go to Washington University, while it may not be diverse, you know of countless amount of people that I've had on the podcast that have gone to Western and found their community, found their success, found the major that they want, and succeed and excel. And because of that, that can be just the amount of inspiration you need to take that step and say, hey, I'll go to Western and I'll be optimistic about it. Now back to the importance of mental health in Black communities. And speaking of that, in fact, there's a lack of Black therapists. In fact, only 2% of U.S. psychologists are actually Black, right? And so one thing we have to address and take into consideration is that Black patients may feel that Black therapists can better understand their experiences and needs and their identity with the cultural stressors that they experience, right? And this is not anyone's fault, right? This is just the reality. 2% of U.S. psychologists are Black, according to this article. Now, what comes with having a Black therapist versus a non-Black therapist? It's called cultural competency and culturally competent care. Now, can anyone do this? Yes. In fact, the article goes on to say, okay, while we've discussed the importance of mental health in the Black community, the history behind where that stigma, that taboo comes from. Great people like Martin Luther King Jr. having depression as well, of course. What can be done about this? What is it that we can do? What are the next steps that we can take to address such and such thing? Number one thing that people can do is that therapists themselves, be it Black or not, can provide culturally competent care. Right? And this article defines culturally competent care as when therapists acknowledge racism's harmful effects. They go into that treatment, that meeting with their next patient, understanding their background, understanding their past and where they come from. Taking trainings, necessary trainings out there to make them more aware of cultural undertones of mental health based on the person, be it Black, Hispanic, white, whatever it may be. But being competent in that, of the culture that this person's coming from, can produce far more successful outcomes than not. Obviously, saying this, how are patients able to find a culturally competent provider? Where can people find this? Well, the article links several databases for Black virtual wellness directories, the National Alliance on Mental Health Illness, NAMI, which I'll all link in the description below. But it also gave some treatment considerations. a community care model of treatment for Black patients. Now, I don't know about you guys, but one thing that's always helped me when I was in college, even to this day, is when I put myself in a community and I'm able to be open with them, to people I trust, about certain things that is going on in my life, it makes it much better. Sharing whatever experiences you've got going on in your life with other people, very effective, very helpful. All right. Communities, the importance of communities can't be understated. And this article makes sure of that and makes you know that for sure. But it also talks about the importance of community and the awareness it brings to the stigma. Right? It's one thing for me to say, hey, there's a stigma in the Black community about this. Hey, I feel the stigma to start counseling, to start going to therapy. But if I'm in a community, if I'm in a room surrounded by other people that have felt that same taboo, that stigma, that fear of what are my friends or family going to say if I embark on this, that relatedness can help. And that can be enough to say, hey, you know what? I'm not the only one feeling this. I can seek the help that I need and not be fearful of whatever so-and-so may say. And Crawford makes sure of that. In fact, towards the end of the article, she says, quote, by recognizing that the Black community has unique experiences when it comes to mental illness, we as citizens of the world are beginning to chip away at the stigma that permeates through culture. End of quote. Lastly, let's talk about attitude. Let's talk about the changing attitude that the Black community can have about mental health. In fact, McLean Hospital put out several quotes that are addressing and deconstructing the stigma behind this. And volunteers were brave enough to share their personal stories, talking about mental health in their communities of color. And I'm going to read 3 of them to you guys. First one, quote, stigma is an evil roadblock that makes people feel ashamed of the struggle they are going through every day and makes them afraid to seek help. Ivy. Mental, quote, end of quote. This is the next quote by Richard. Quote, mental illness does not discriminate. No matter what age, color, or religion, anyone can live with mental illness. End of quote. One more quote by Cynthia. Quote, mental illness in the Black community has long been a touchy topic. The overriding belief is you don't go to therapy or counseling or take medicine. You go to church. And you don't talk about your business to anybody. You put on your big girl pants and keep it moving. That's what I did. Except I wasn't going anywhere. End of quote. You see, in my culture, you're told a lot to tough it out and persist on. And there's nothing wrong with that to a certain extent. In fact, that kind of mentality, that background that I grew up with, helped me persevere some of the hardest parts of my life. Helped me become mentally sharper, mentally stronger, mentally able to overcome anything that life throws at me. However, we must understand and remember that we're human. And seeking treatment is not a sign of weakness, but a sign of strength. And that is where I myself to this day am struggling with that too. Being told obviously to be a man and man up and do whatever you got to do to take care of whatever you got to take care of is one thing. On the other hand, there are certain things that happen in life, certain traumas that I can't just bear with myself, but that I have to seek help with. And that could just be a friend, a family member, a trusted acquaintance, coworker, or a therapist. Whatever it is you're going through, talk to someone today. Seek out help. Seek out that. You're not going to be weak when you're doing that. You're going to be even stronger. Don't worry what other people may say or think about you by doing that. But seek the treatment that you need, because this is your life you're talking about. We only have one life here on this earth, so we might as well enjoy it and make the best use of it and help others do the very same thing. Thank you so much for listening to this podcast. Tune in to all my socials, as always, TikTok, Instagram. Keep up the podcast. Subscribe on YouTube. Follow on Spotify and Apple Podcasts. Stay tuned for more awesome episodes as Season 5 rolls on. And if you're willing to, consider donating monthly or giving a one-time donation on Buy Me a Coffee. And I'll link all those links in the description down below. Let me know what you think of this episode. Let me know of any future episode topics you would love for me to talk about here on The Black Experience. And if there's anyone that you would like me to collab to, don't be afraid to email me at ermiashagos46@gmail.com. Until the very next one, y'all. Peace. What is up, y'all? Thank you so much for tuning in to that episode. Make sure to click the subscribe, follow button, as well as the bell to get notified on all my new content that is coming out every Wednesday and every other day. And make sure to click that link in the description down below to get access to all my socials and any other platforms that I have my podcast on. And until next time, y'all, peace.